COVID-19 turned the world upside down almost overnight. Everything came to a complete stop, and even New York City, the city that never sleeps, grinded to a halt. But for the healthcare system, the exact opposite had to happen. Almost overnight, first responders, physicians, nurses, doctors, they had to step up and take on a much larger role, one they never expected to have. Part of that healthcare response was also the response of pharmacists. While many might not realize it, pharmacists played a large role in how the healthcare system reacted to COVID. They ended up administering over 70% of all COVID vaccines, administering COVID tests, and once it was released, were able to prescribe and dispense Paxlovid. What Paxlovid is, it's a medication used to treat the onset of early COVID symptoms. And while pharmacy prescribing is still a very fairly new concept, it's one that has a lot of room for growth. The first instance of pharmacists being allowed to prescribe in the US was in New Mexico in 2013, where they gave pharmacists the ability to prescribe Narcan. In the 13 years since then, there are now only 2 prescriptions that pharmacists in all 50 states can prescribe, that being Narcan, and this one added just recently as of December 2025, buprenorphine. And there are a small number of other things that pharmacists can prescribe in most states. For example, in about 40 states, pharmacists can prescribe a combination of antivirals or antibiotics. And in about 20 states, they can prescribe for birth control. But that's it. That's all pharmacists can do currently. So why is that the case? A lot of people don't really see pharmacies as a location where you would go to get a prescription. But I can see that changing very quickly, very soon. With the rise of AI, the role of a pharmacist is going to evolve very rapidly. I know what you're thinking. Oh, another talk about AI, all this endless speculation. But honestly, a pharmacist's role, part of it is very repetitive things that are very easily sped up and made efficient with the use of AI. And so if we're able to integrate AI, we can allow pharmacists to spend more time applying their clinical knowledge one-on-one with the patient. And part of that looks like pharmacists being able to prescribe. The second largest issue that comes with pharmacists prescribing is not a lot of people think pharmacists have the clinical knowledge or experience to be able to prescribe. But I want to challenge that entirely. I work at a pharmacy as a pharmacy technician, and my pharmacist is easily one of the most intelligent people I have ever met. Recently, we had this patient come in who was undiagnosed diabetic and had just found out he had diabetes. And so the doctor wrote a prescription for Synjardy. And Synjardy, it's a very expensive prescription and not typically a first line use to manage diabetes. So when we tried to bill it, the insurance rejected it, saying to use something cheaper. Now this was a Friday afternoon, and the patient came in to try and pick up the prescription. And all we could tell them was that, sorry, the insurance rejected it. It was going to be $2,000 out of pocket, which is frankly absurd, and no one has that kind of money ready on hand. But my pharmacist always wanted to go above and beyond. She tried contacting the doctor. And so for 20 to 30 minutes, she was left on hold, jumping around receptionists trying to get through to the doctor. And while she was waiting, she mentioned to me and some of the other techs there that all the pharmacist would really need to do is call in a prescription for metformin 500 twice a day as a reasonable alternative. Now eventually my pharmacist gets through to the doctor, and lo and behold, that's exactly what the doctor prescribes. All this to show that pharmacists do have that clinical knowledge to intervene and to write prescriptions, and if we allow them, they can take up a much larger role in our healthcare system. The way I see it, pharmacists can play a much larger role in being able to diagnose and prescribe for a lot of the more common ailments. Have you ever felt under the weather, and so you took time off school or took time off work to go to a doctor's office, waited half an hour to an hour in the waiting room, made it into the office itself, and then waited another 20 minutes to see the doctor, all for the doctor to do a quick flu test and prescribe you Tamiflu? You wasted almost 2 hours and a day of work just to interact with the doctor for 5 minutes and get prescribed Tamiflu. So why couldn't you just go to the pharmacist who can also administer that same test and come to that same conclusion and be able to write you that prescription and dispense it right there? Now I know a lot of people think that this might just be shortcuts, but it's using healthcare system as efficiently as possible. This isn't fully speculation. In Canada, there was a similar issue, and so they introduced something called the 9,000 points of care system. And what it did is that it allowed pharmacists to write prescriptions for some of these more common ailments. And what it did is that it freed up over 600,000 visits to emergency rooms, urgent cares, just normal checkups that in turn also freed up 2.4 million hours that physicians could use to focus on much more extreme cases and much more difficult cases where they would need to speak with the patients. So showing that the system can work, and if we allow pharmacists to take part in it, they would be able to help out. Another thing that I can see pharmacists playing a large part in assisting with is just being able to write refills on prescriptions. There was another patient we had come into our pharmacy once, and she had recently just switched insurances, and she was no longer being covered at her primary doctor. So she had to find a new doctor entirely. And this doctor didn't have any appointments to see her for 2 weeks out. And she had just ran out of refills on her antidepressant. And so all the pharmacist could do is give her a 3-day supply and tell her, to your best of your ability, try to call your doctor and try and explain the situation and hope that they'll send in that prescription for you. And if that doesn't work, your alternative might be to try going to an urgent care and hoping that you'll find a doctor there who'd be willing to write a prescription for you as well. In neither of those cases is it guaranteed that she'll get a refill. And with antidepressants, if they're not prescriptions that you could just automatically stop, you would end up feeling antidepressant discontinuation syndrome, which feels a lot like withdrawal. But the pharmacist who's sitting right there has her entire medicine history on the computer. She can see that this patient has been on that antidepressant at that same dose, at that same strength for the past couple of years, and there wasn't a single thing she could do about it. So if we allow pharmacists to play that role and to add refills, we would save the patient the trouble of trying to contact their doctor in urgent care, save them the stress of not having their medication, and save everyone time and the healthcare system money. Why would we want to do this in the first place? Well, the healthcare system in the United States is running into a very big issue. Right now, a lot of baby boomers are starting to retire. And with the retirement of baby boomers, we're getting a lot more physicians who are leaving the healthcare system than physicians who are entering it. In fact, by 2031 specifically, there will be more people retiring from the workforce than entering it. And at that same time, as baby boomers are getting older, they're going to need more prescriptions, more maintenance medications, and we're essentially tumbling towards a situation where we need a lot more people helping out in healthcare while also losing people in healthcare at the same time. So if we allow pharmacists to fill that gap, to fill that void, they would be able to save the healthcare system time and money. And even today, the healthcare system is on the brink. 47% of healthcare providers have mentioned that they feel extremely burnt out and have contemplated leaving healthcare entirely due to the stress that it's causing them. So if we allow pharmacists to step in and help them out with that, it would create a better healthcare system and a healthcare system that could better serve the population. Now, this isn't something that's going to happen overnight, obviously, but if we start working on it now, we will be able to develop that for the future. We need to develop certification programs that allow pharmacists to continue their education, to be better prepared to prescribe, and so that we're not just throwing them into the fire, but making sure they're ready for it. So for any future pharmacists in the crowd here, advocate for yourselves. Try and look around for these certifications so that you'll be able to prescribe medication, so that you could play a larger part in healthcare, and so that you can be able to contribute to something greater. For anyone else who's in healthcare but might not be a pharmacist, advocate for your pharmacist brothers and sisters. We're there to help you, and we want to alleviate the stress off your shoulders. And for anyone else who might be here who might not be in healthcare at all, just know that pharmacists are here and they're some of the most knowledgeable people you'll find when it comes to medications. So if ever you have any questions or any concerns, you could always go to them. And hopefully someday soon in the future, they'll be the ones writing the prescriptions for you. Thank you.